ZUMA-5 is a large phase 2 multi-center and international trial testing Axicabtagene, ciloleucel, or Axicel, which is an autologous anti-CD19 CAR T-cell therapy in patients with relapsed or refractory indolent non-Hodgkin lymphoma that included patients with both follicular lymphoma as well as marginal zone lymphoma. So in this, at this ASCO meeting, we are presenting the 9-month analysis on this study. There were a total of 140 patients who were enrolled and treated. Of those, 96 patients were evaluable for the efficacy at the time for the ASCO meeting with at least 9 months of follow-up. And of those 96 patients, about 80 patients were folliculars and 16 patients were marginal zone. So the treatment for this on this trial is very similar to Axicel in the ZUMA-1 study or the commercial product, where patients undergo leukapheresis. The product is manufactured within 2 to 3 weeks, and then they receive conditioning with lymphodepletion with cyclophosphamide and fludarabine for 3 days, followed by Axicel CAR-T infusion on day 0. So on this study, we've observed that the efficacy was very high with the autologous COVID Axicel product. The overall response rate was 93%. The complete response rate was 80%. And with a median follow-up of 15.3 months in the follicular lymphoma cohort, 68% of the responses are still ongoing, which indicates it's highly effective in this relapsed refractory patient population. We also found that the safety of this therapy seems to be better in the follicular lymphoma cohort compared to what's been previously reported with diffuse large B-cell lymphoma. Both cytokine release syndrome and neurological toxicity severity seems to be lower. The grade 3 or higher CRS events were less than 10%, and the grade 3 or higher neurological toxicity was about 15%. So overall, I think this looks very promising treatment for patients with relapsed or refractory follicular lymphoma as well as marginal zone lymphoma. However, this is interim efficacy analysis, and the 12-month efficacy analysis will be presented hopefully at the ASH meeting later this year.